In my opinion, radiology has probably seen the most significant amount of technological advances compared to most other medical subspecialties. We have actually, in the last 10 to 20 years, done some very cutting-edge things which really help the patients the most. For example, we do a lot more image-guided procedures, such as biopsies, than we've ever done before. And it's because our technology has become so sophisticated, which allows us to see small lesions that previously would not be seen, or to actually biopsy masses or lesions which were previously only things that we could do in the operating room. But here we could do those right here in an outpatient setting under local anesthesia. And the patient's results are fantastic, where they can go home right away and resume their normal activities the next day. So in my opinion, that's something that's very helpful, not only for us as radiologists, but also for the patients. The other thing that I think is exciting and pertains to the breast imaging world is tomosynthesis. How exciting is it to imagine that what we used to see before was almost a veil on it, and now you've taken that veil off. And that's what tomosynthesis has done. It has literally taken the veil off of 2D mammography, where now we can actually see areas, especially in women who have dense breast tissue. And those areas perhaps could have been masked because of all the tissue. They were not seen. And now with tomosynthesis, which is almost like flipping a book and looking through all the pages, as opposed to earlier where you're just looking at the cover of the book. So you can only imagine how much more information we can obtain from tomosynthesis and how many more cancers we can detect and smaller cancers that we can detect. And the smaller the cancer, the better the outcomes for the patients. So for me, that's very exciting that I can offer our patients such a service. And of course, the other thing that's being talked about within radiology as a community, as a whole, is artificial intelligence. And that has a lot of potential. In fact, I think it's something that we're all looking forward to in the next coming years as to how artificial intelligence will benefit the breast imaging world. I know it's being used in many other parts of radiology, in musculoskeletal or body imaging. I'm very excited and hopeful to see how artificial intelligence will be incorporated in breast imaging.